is Jane did a really great job of introducing. There's two main air pollution drivers of risk in Louisiana. And the first is particulate matter. In addition to everything that Jane said, each year it kills more than 4 times the number of people that have died from COVID-19 in the last 12 months. The second set of drivers is two particular air toxic pollutants, which cause areas of Louisiana to exceed the cancer risk threshold in EPA's action level of 100 in a million. So what do we know about those pollutants? Well, the National Air Toxics Assessment, which was based on 2011 emissions, was released to the public in 2015. St. John the Baptist Parish had the highest county level cancer risk in the US, more than 2.5 times EPA's action level. And it was primarily driven by chloroprene emissions from DuPont and Dinka. And the neighborhood around DuPont Dinka had risk at more than 8 times the EPA action level. And indeed, EPA acted, and they acted quickly. So first they convened meetings to check all those numbers. Then EPA Region 6 installed neighborhood chloroprene monitoring sites. Region 6 conducted a compliance inspection at Dinka, and they identified 50 potential violations. They began the first of a series of meetings with the residents and the public, and that inspection eventually led to a consent decree where Dinka agreed to reduce their chloroprene emissions by 85%. So, at that same time, emissions were increasing, though, according to the 2004 data, which was released in October of 2018. The cancer risk levels in Louisiana had practically doubled. So St. John Parish again had the highest county level risk, but this time 47% of that risk was driven by ethylene oxide from ebonic, and 44% was from chloroprene. The neighborhood around Dinka, the risk had increased from 8 times the action level to 15 times the action level. And in addition, 2 additional Cancer Alley parishes were above the EPA action level, and the highest was St. Charles. Unfortunately, though, this time there was no EPA action or response at all. No installation of ethylene oxide monitors, no compliance inspections, and not a single meeting with any of the communities impacted. So what did the health department know about the exposures and the health effects, and when did they know it? So if you're not familiar, the IRS, starting in 2012, required nonprofit hospitals, all of them, to conduct a community health needs assessment and adopt a strategy to address significant needs every 3 years. The regulation specifically prohibits the exclusion of medically underserved, low-income, and minority populations. So we know that just before the NADA was released, that the health department was collaborating on 2 of these CHNAs. One with the Metropolitan Hospital Council of New Orleans that included 99% of St. John's population, and then East Jefferson General, and that included 78% of the population from St. John. And what they find? They found asthma rates among children that were higher than every other one of the comparison area parishes, and more than 2.5 times the national and the Louisiana rates. Same was true for young adults, except for the risk among them was also equally as high or higher within St. Charles Parish. What else did they know? Well, this is very same year, at the same time they were collaborating on those two CHNAs, the health department was requested to investigate separate outbreaks of asthma-like symptoms among 650 elementary school students at East St. John Elementary. And in addition to the outbreaks, the nurse reported getting complaints of many, many different types of symptoms, including vomiting and weakness. The health department finding was that the schools were in a high-risk area among industrial facilities that produce airborne particulates and also risk from chemical releases. They recommended that that school be relocated. In the meantime, they needed a plan that would prevent the exposures of particulate matter and manage the indoor air quality. And I'll just point out that the school happens to be located next to the 5th highest emitter of PM 2.5 in the state, and next to the two Dinka and Ebonic, next to the two air toxic risk drivers. Not long after that, in 2018, the health department was again petitioned to come and do an investigation. This time they were asking if the 5th Ward Elementary School, located right here about 1,500 feet from the Dinka fence line, if those students should be relocated after the chloroprene emissions have been reduced to 85%. And they conducted analysis, but it ignored past exposures to the concentrations that were 25 times higher than those starting in 2018, and that did not consider ethylene oxide or any other exposures. Despite that, the health department found that the students continued to have elevated lifetime cancer risk. However, the concentrations and the risk throughout the entire parish were at such a level that moving them would not greatly decrease those risks of developing cancer. So just to summarize, the health department had no plausible deniability. They had firsthand knowledge of both asthma and cancer risk, not only among students, but across St. Charles and St. John. They've been silent. Well, first, they've done no follow-up to any of those reports. Additionally, they've been silent even when St. John had the highest COVID-19 death rates in the country, and Cancer Alley parishes had they continue to have some of the highest death rates in Louisiana. And after 3 independent studies found independent links between COVID-19 deaths and exposure to PM 2.5 and air toxics, and that was specifically in Louisiana. So not only have they not followed up, but as implausible as this sounds, there has never been an EPI study conducted that examined the relationship between air toxics and PM 2.5 and all of the expected health effects in Cancer Alley. Even though the health department has access to local data on all of those health effects, and as we just talked about, there's high quality exposure data available for air toxics and PM 2.5. So even though no one has ever invested in that kind of desperately needed study, the health department, LDQ, has accepted over $300,000 from EPA to conduct what they're describing as a study. And what it really is, though, is just an assessment of the completeness of the cancer registry for the populations right around the Dinka facility. And it's designed to fail for multiple reasons, including that it's not including air pollution or any other kind of exposure data. So I'm leaving with the question of, with all the evidence we have, isn't it time to hold the health department and all of the other elected officials and agencies accountable? And I believe Gail's going to lead a discussion to try to answer that. Thanks.